Hello, I'm Tracy and I'm at the VELA factory today and I'm happy to show you the mammography chair. I'm going to show you the features of the chair to begin with, and then we'll talk about the benefits to the patient and to your mammography team. So first of all, the chair itself. The base frame is in the shape of an H. This is quite deliberate by design because it not only gives great stability by the shape of the design, but also the proximity that it allows when you are offering the chair up to the imaging equipment. So you have nothing hindering in its way. The casters themselves have a rubber tread, so you have no slip and smooth rolling. They're filled with ball bearings, which gives a high quality smooth roll over all hospital surfaces. The brake you can find has easy access from 360 degrees around the chair. It's very simple to operate. On either side, you just simply press down with the ball of your foot, and it's also accessible from the other side. So whichever side you're working, you don't have to move around the chair. You'll also see from behind, you have the positioning here as well. The footrest, you can see in the front here, is for the patient. So regardless of what height adjustment you have positioned the chair to, the footrest will raise and lower by being attached to the seat, so your patient doesn't feel insecure and doesn't have any feet dangling at any time. The height adjustment is easy to use, simply by way of a handset, and it only has two operations, being up or down. The chair is currently positioned at its highest working point, which is 81 centimetres. But let's say we have a patient who has restricted mobility, or they're quite short in height, or they don't have any mobility at all and might be a wheelchair user. So we can simply take the chair down. It doesn't make any noise. It has a very smooth adjustment to it. And it also has a slow stop. So there's no juddering movement when it comes to a complete stop, like so. At the lowest point, it's actually only 51 centimetres from the floor, making it perfect for wheelchair users. For a wheelchair user, you have the adjustment on the armrests by releasing the button, and then you can do a side transfer. You will also notice with the armrests on either side, it is very stable by taking a weight load of up to 130 kilos on either side. So when somebody is accessing or exiting the chair, they can bear down with their weight and you don't have any risk of tipping. So the chair itself is electrically powered and it's portable, so you don't have any connection to the mains at any time, by means of a battery pack. So I'm just going to show you with the battery pack exactly how to see how much power you might have left at any time. So you can see under here, you will have a green light, and that will illuminate to show you how much power is left in the battery. A common question that we get asked is, how long will my battery last me? Now this will be very dependent on how many times the chair is raised or lowered and the weight load that it's taking on any elevation. For usual clinics that are very busy, then you will expect to have repeated use of the chair over and over again. We would ordinarily expect the battery to last you at least a day, and we would highly recommend that it's plugged in overnight. To be able to recharge the battery, you simply take the handset, remove the connection from the bottom of the handset, take the charger that the chair will be supplied with, connect it to the charger, quite simply, and then plug the charger into the main supply. When you're done, remove it, plug it back into the handset, and you're good to go, and your chair should now be fully charged. When you're using the handset, then you want to make sure that it's in the same place to come back to every time. So what we have for you is some simple hooks on each armrest, both here and around the other side. So when it's not in use, one, you know where to find it the next time, and two, it's not going to be laying on the floor and at risk of being rolled over or damaged or trodden on. So not only do the fold back armrests facilitate an easy transfer, but also on either side, they both go back completely. This will allow for positioning the patient and allowing the imaging equipment to come into a lateral view. The actual seat pad itself has high durable foam and a vinyl covering. The vinyl covering is made from a medical grade vinyl and is easy to clean with all usual disposable disinfecting wipes. Now we'll move on to the backrest. The backrest has an easy operation. There has a lever to one side, and by raising the lever upwards, you can move the backrest very easily when the patient is in the chair. Now, I've deliberately left it at its most forward position. You can see here, it's slightly angled towards the front. This is quite deliberate, so that when you have your patient seated and you're offering them up to the imaging equipment, they will be naturally pushed forward. You will also notice there's a very subtle gradient on the seat pad. This also allows for when the imaging equipment needs to detect the side view, this tilt in the seat pad opens up the hip from the abdomen, and then you don't have the armrest in the way for any side view. This allows for optimum positioning and accuracy for the imaging. I just want to show you the transport handle, which is one of the last features of the actual equipment itself. So it looks very much like a pram handle, and it has an ergonomic adjustment so that for any height user, you can lower or raise the chair to where you need it to be, because the handle is fixed to the seat, so it will go up and down with the chair. What I would suggest is when manoeuvring the patient in the chair, have the handle in the raised position. And when it's upright, you can grasp it here and it will make for easier manoeuvrability. You will also notice that with the easy manoeuvring on the casters, you can have a lateral movement as well as a forward and backward motion. So let's talk about the benefits to the patient. I've had the experience of talking to a number of mammographers and also first-hand experience of being imaged myself. I would like to suggest that, and so with the people I've spoken to, that the experience is more comfortable from the patient's perspective when seated. Not only can it alleviate anxieties from not having to stand but being seated, but these anxieties can be induced whether you are symptomatic or asymptomatic, and give the patient a more relaxed experience. Having to maintain a particular posture and be very, very still for accurate imaging can sometimes be difficult, even for the most able of people. So therefore, to sit down during this experience can again make that more comfortable and reduce the necessity for repeat imaging for first-time accuracy. A number of mammographers have actually shared with me that the risk of falling is a more frequent occurrence than you may expect. So by having your patient seated, regardless of their ability, does mitigate that risk of falling, thus preventing injury to themselves and any consequence to the knock-on effect on your clinic from that event occurring. So now I'd like to talk to you about the benefits to your team and your mammographers. The benefits will give you an overall cost saving through the ergonomics of this chair. So first of all, we're going to talk about the gradient on the seat section here. It's very subtle and it's not that easy to see. But when your patient is in the chair, they will feel slightly inclined forward, which helps, as we suggested, to open up the hip to abdomen area. But when you have the armrest folded back, for an MLO view, it does mean that you don't have to exert your strength to be able to create the optimum position, and thus it's going to have less impact on your spine. With the easy lateral movement of the chair as well, this further supports optimum positioning without affecting your own well-being. Then we have the height adjustment. So by being able to maneuver the chair to a suitable working height for you, in proportion to your patient's height, it means that even the shortest or tallest of people don't have to bend or stretch or tiptoe to create the best position. So when you're doing this repeatedly every single day, you don't have that tension in the back of your shoulders, in your arms, and therefore you are going to be reducing the effect of work-related musculoskeletal disorders. Likewise, the backrest that we have here, it's very easy to manoeuvre when your patient is seated by pulling this lever up that we demonstrated earlier and creating that forward position. This is as far forward as it goes. Your patient is going to be naturally pushed towards the imaging equipment so that their breasts can meet the plates without you having to lean into them to push them forward yourself, further alleviating any tension in your back, spine, shoulders and arms. One final feature where it will support your team and your mammographers is in the transport handle. So whilst we've demonstrated this already, I just want to point out that the ergonomics here means that you need minimal amount of push or force to manoeuvre your patient. By doing so, it does mean that you can improve the patient flow in your clinics because you can easily transport your patients from the waiting area to the clinic room and back again, particularly if they have restricted, limited or no mobility at all. And therefore you can get through your clinic lists far more efficiently. It also means that with the accurate positioning that you can create for stability and the comfort for your patient that would have to create that posture for a period of time, you will hopefully improve the accuracy of your images and therefore avoid the repetition of appointments. This will reduce the waiting times and give a cost saving to your department. The seated mammography experience will also mitigate against the risk of fainting and falls. So as we were talking about the benefits to the patients earlier, there's also a benefit to you and your team. You have less occurrences of fainting and falling, and then if somebody were to faint, they're already seated, and therefore you're going to be able to prevent injuries. Overall, this piece of equipment will not only support your clinic in cost savings for reduction of repeat appointments, a better patient experience, but overall, the biggest cost saving to be had is by using this chair, you are going to be able to reduce the risk of work-related musculoskeletal disorders. We have various evidence at VELA that suggests that the number of absences due to this condition is significant in mammographers, and here we have the solution to protect your workforce, provide well-being, and give cost savings through the ergonomics as well.